I think this is our first fertility medication event, actually.
Oh, yay.
Yeah.
Well, hopefully I'll do it justice. I'll do my
Absolutely. So we can probably get started and then people can jump on when it's convenient for them. So, hi everyone, I'm Kristen Hodgson. I'm co-founder and chief community officer at Rescripted, and today I'm joined by Christine Calvitti of Rosemont Pharmacy. Welcome, Christine.
Thank you for having me.
Of course. So fertility meds can be one of the most confusing parts of fertility treatment, as you know. You know, not every clinic gives the most or gives the least confusing instructions. And there's these different portals you have to log into, and you have to remember to take all these different meds at different times, and it can just be a lot. So today we wanted to talk about, you know, side effects, what to expect, and the whole nine yards when it comes to fertility meds.
Sure.
So I guess first tell us a little bit about yourself, Rosemont Pharmacy, and your role at Rosemont.
So, as you had mentioned, my name is Christine Calvitti. I've spent the last 12 years at Rosemont Pharmacy, and we operate out of the Philadelphia, Pennsylvania area, and our only specialty is fertility medications, while we do operate a full service pharmacy as well. So we've been in business servicing fertility patients for over 25 years. And I interact a lot with clinics and with the internal pharmacy staff to just streamline the entire process and constantly find solutions for anything that comes up. So I hope that that knowledge is useful in answering and addressing some of the questions that you guys have come up with.
Absolutely. So I think like this question definitely came to my mind when I first was starting fertility treatments. Why can't you get fertility meds at your neighborhood drugstore like Walgreens or CVS?
So that was actually my first question as well when I was exposed to the fertility market. And in all reality, you could get them from your local drugstore. There's a few hurdles that would make it not ideal for a fertility patient. The first and foremost being pricing. So while they could order it from their wholesaler, they would not have access to any of the discounted pricing that all specialty fertility pharmacies are able to get through their contracts with manufacturers. Aside from that, you won't see them wanting to stock the product due to its elevated cost and expense to keep it on the shelf. So they would be taking sometimes up to 2 weeks to order that product in for you, which is, again, not ideal for a fertility patient just because of the time sensitive nature. And then the last and possibly, most important to some people is that they just won't have the proper knowledge about your treatment and the medications themselves in the event that you need support in that fashion. So that's mainly why you don't see that route being chosen by fertility patients.
Yeah, absolutely. That makes sense. So what is the role of a specialty pharmacy then?
So overall, specialty pharmacies, they're really, the main role is to provide optimal knowledge, support, and pricing for any, like to meet any of the unique needs that come along with a certain disease state or condition, in our case, infertility. So to do so, we employ very highly trained fertility specified staff members, fertility coordinators. We do ongoing training to keep up with the different changes in the fertility market space in regard to medications. We have specified insurance knowledge pertaining directly to fertility. And then again, we contract with those manufacturers to provide exclusive access to discounted pricing on medications. So that's kind of encompasses the full role of, where we fall and how we do it.
Okay. Well, so I mean, I know on my journey and even in my current journey, I haven't really felt like I can ask my pharmacy questions. So what should like the ideal role of a fertility specialty pharmacy be? I
So
don't think a lot of people consider them as the resource that they can be to patients.
So I think that that's just such a failed opportunity for a pharmacy to really accommodate the needs of a patient like that. So the way that we view our role in this space as a fertility pharmacy is we want to really be just a continuation of care. So you have such a personalized experience at your clinic, and then they send your medications off, and it's not to us at least, we don't want to just dispense the meds and leave it to you. We want to provide ample documentation. We want to be the first person you call in the event of a question regarding your medications. And for that reason, I mean, we, along with other specialty pharmacies, provide 24/7 access to a pharmacist, and we encourage all patients to use that as much as possible. So you can call me if you have any questions.
No, it's true. I mean, like funny story, we were administering my first progesterone and oil injection a couple weeks ago, and my husband was freaking out because, like, as if he's never done this before. Like, this is our second round of IVF, but freaking out. And then I started bleeding a little bit, and I don't think that ever happened last time. And he's like, is that normal? Like, we had all of these different, like, I just wanted to be reassured that we did it correctly. We did it in the right spot. We, bleeding was normal, bruising was normal. And like, I kind of wish that I had known who to call in that moment, because my fertility clinic was closed. And so I think it's so amazing that you guys provide that service.
Yes. So we are open to patients to any capacity that they need. So a patient can call us and say, I'm going to be doing my first injection on this date at this time. Like, would someone be available to jump on a call? We're happy to do that. Again, if they're just receiving medications and it's this huge box, can someone hop on? We'll do a virtual consult. We'll do a call. We'll go through the stuff with them, because a lot of the different steps can be intimidating, and it doesn't, like, in your case, it doesn't have to be the first injection. It could be, for whatever reason. So the pharmacy should be able to provide those kind of services and support.
Absolutely. And a lot of times you don't even know what to expect. Like, it was like, I think 2 weeks in where I started getting bruising and like a lump on my injection site. And I just wanted to know that that was normal, and no one had really told me ahead of time to massage the area. And like, I wish I kind of had that information up front,
Right.
or was able to access it readily.
Yes. So those questions, at least at Rosemont, we do welcome any patient to call at any time and say, hey, I noticed bruising. Hey, is this normal? And we're usually able to address those types of questions. And then if it is something that's outside of the realm that we would feel comfortable with, we would, again, advise you to go back to your prescribing physician or nurse to verify.
Yeah, that was actually going to be my next question. So when should you go to your pharmacist versus your clinic?
So that is a very good question, because some of it is like a very gray area, like that example. As a general rule of thumb, if it's treatment specific, if it's dosing, anything like that, you want to go to your nurse, you want to go to your physician. Anything that is not unique to your specific plan. So something that's medication related that you feel like will be the same answer for you as it is for every other fertility patient. That would be more storage requirements. What happens if I left this medication out of refrigeration? Just different administering questions. Like, a pharmacy can usually field most of those questions. And then again, we are trained to know, like, okay, this is outside of the realm of what is our, area of specialty. So again, go back to your physician, but you can always feel free. If it's medication related, call your pharmacy first, and they'll be the ones that can direct you if you think you need to reach out to the clinic. If that might seem to be like an easier way to get a hold of somebody quicker, to know where that question belongs, if that makes sense.
Yeah, absolutely. So I wanted to touch on pricing for a second.
Okay.
I did not realize that you could sort of shop around. I just wasn't really educated on that. Like, my fertility clinic at the time just gave me a pharmacy and I didn't question it. But I think something that's really important to note for current patients is that you can shop around, and that, different pharmacies offer different pricing on certain medications. So why is it that they're able to offer different pricing?
So when it comes to fertility pricing, it will all depend on which contracts each specific pharmacy has with which manufacturers, that can offer significant differences in the actual cash out-of-pocket cost for certain product lines. That can get very complicated to explain, so I hope that kind of makes sense. But if you're within a specific subset of pharmacies that have the same contract with the same manufacturer, you should be in a similar price range. They should be comparable, but there is going to be fluctuation again, and that's just due to the nature of any type of business where, you know, you can offer a spring special, or you could discount something and then increase the price on the back end of something else. But they should be fairly comparable for pharmacies that have the same two contracts, if that makes sense.
Yeah. So is it that you guys have like discount programs with certain manufacturers? Can you tell us a little bit more about how that works and how patients might be able to learn more about them? Because I feel like on the front end, when you're being prescribed meds, you might just not, like, that's all kind of behind the scenes.
Sure. So basically, if you're a fertility specialized pharmacy, you contract with, there's three main manufacturers of fertility products in the United States. So you either have Organon, which was previously Merck, you have Serona, or you have Ferring. Each of them has their own line of products. And again, like I said, depending on who you contract with, that would designate what your standard cash discount pricing. So the pricing that you get just for being a fertility patient from Rosemont. So we get a discount just by having that contract. That's where you get the savings versus like a CVS or a non-contracted pharmacy. Mm-hmm. Above and beyond that already discounted price that we have, that's when the discount programs come into play. So discount programs, there's a wide variety of them. Every manufacturer has some formulation of different discount programs available. The most widely used, I think, between Organon and Serona, they both offer like an income-based discount program for patients that would be, you know, if it's an Organon, you would apply through Reunite. And again, this is where it gets kind of confusing. So you would apply through Reunite, who does all of their discounting. And then it's a very simple process. You would just put in patient demographic information. They would ask for like a 1040 tax document, which it can be as easy as like taking a picture with your phone. And then within 48 hours, you will have an approved additional discount based on what you provide them. And then Serona has a similar discount program for their products, which would be if it's Gonal, Cetrotide, Avodrel. And that's called Compassionate Care. Again, you would go onto their website, apply for that program, and then see what your level of discounting is on the back end.
Okay, got it. So if you were prescribed a medication from a different manufacturer, so say instead of Gonal F, it would be Follistim.
Yes.
Can you guys still prescribe, or can you guys still fill that, or it would just be at a less discounted price?
So we would not fill. So at Rosemont, we are an Organon affiliated pharmacy. So we have discounting on Follistim, Pregnol, and all of the products that are associated with that manufacturer, if that makes sense.
Yep.
And also Ganirelix. If we were to get a cash prescription for Gonal F, and we know that our pricing is going to be almost double for that product, just out of being good natured, we're not going to fill that. So we would tell them, you know, we don't contract for pricing for that. But again, these products are by a lot of clinics used interchangeably. So that's where the differential comes. So a lot of people will want to compare their Gonal, Avodrel, and Cetrotide pricing from a Serona pharmacy versus what they would pay for Follistim, Ganirelix, and Pregnol at an Organon pharmacy. And that's where you get a more appropriate comparison of what to expect for like your full cycle.
Perfect. So can you get meds from overseas?
Technically, there are a lot of websites out there. I've seen them, patients ask about them, and I love that they're doing their due diligence to see what is available to them. However, you run some risks, very hefty risks, with considering overseas medications. For one, it is not entirely legal for them to to bring pharmaceutical products into the United States and to deliver it to you. If that is not a risk that is concerning enough, you also have no FDA coverage. So if you have an adverse reaction or a bad outcome, or there's an issue with your medication, you don't really have support to do anything about it. And then aside from that, another huge concern can be medication storage and how it was transported and how it was treated. So they don't have the same governing bodies in those in other countries, depending on which country you're getting it from. There's just not the same regulatory bodies in place to make sure that your Follistim wasn't in the back of a truck for 4 weeks before it was put on ice and sent to you. So if that makes sense, are there reputable pharmacies overseas? I could never say there wasn't. There sure is. But you do run a definite risk with taking that into consideration.
Got it. Someone's asking, is it legal to get a med donation from a friend that didn't use her med during an IVF cycle?
I don't know if that would be a legal concern. I would have to look into that, because I don't know if like giving someone a prescription that was prescribed to you, I don't know if it's a legal ramification or what would be, I guess, more so the outcome if it were an issue.
Right.
So I know that like some offices won't take any donated meds back for different, concerns. Again, you don't know what a patient did with it. If it was a friend to a friend, I'm not exactly sure, but I'm happy to follow up and let you know what the recommendation is. Because again, I know some people will like trade online with people they don't know. And that's a little bit more of that gray area where you don't know what their storage was. You don't know if they opened it. So again, they're all risks that you need to weigh in your own journey and see kind of, it's not recommended, but there are, people that are going to make decisions that they feel are best for them.
Yeah, no, I hadn't even thought of the storage ramifications. If they didn't store it correctly, it could, cause an issue. So speaking of that, I think one of the most daunting days on an IVF journey is getting that big box of medication at the beginning. So what should a patient do when they get that box of medication?
So I love this question because I think it is something that is overlooked, and just with all the commotion that you have with your cycle and this, and it's like, okay, we're ready to start. And then you get this box of meds, and we're in a day and age where I have a lot of Amazon packages that are currently sitting outside of my house. And you have Wayfair, you have all different entities that are sending and shipping different things. So you really want to make sure you prioritize, know when it's coming, and mentally before it even gets there, just know that when you see that box, when you receive that box, you want to set aside at least 15 to 20 minutes to really get into it, familiarize yourself with the medications. And again, we're talking about if it's a full IVF order. So you could have anywhere up to like 16 different items in this box. And you really just want to make sure you set yourself up for success by giving yourself the appropriate amount of time. We've had patients look at it and say, I can't deal with this right now. They stick it in their closet, and all of their refrigerated meds were no longer refrigerated by the time they got back to it. So in that aspect, once you do sit down with it, the first thing I recommend and will always recommend is try to find the insulated white pack. I think they should all be white, but an insulated pack, most IVF orders have some refrigerated component. Open that immediately and make sure that those items get put into your refrigerator. So then if you do find yourself interrupted at some point in this unboxing experience, you can at least have the knowledge that those items are safe where they are and everything else can be, handled at a later time. From there, I would say, you have supplemental documentation that comes with it. We send out a folder. It has every medication storage, all the information, what each product is, what it does. and just, again, all the ancillary stuff about pharmacy services. You can feel free to browse through that. But more importantly, you really want to organize and familiarize yourself with what is in this package in terms of your non-refrigerated medications. So go through them. If you have like a little bin or somewhere that you have designated to store it, you will thank yourself later, because you will not have the added concern about where something is when it's time for the injection. You really want it, like when you're taking your meds, you really want to be able to focus on that. So organizing everything, understanding it, seeing which product looks like what, where it falls in your cycle. And then again, doing the same thing with your needles, your syringes, your alcohol swab, sharps container, all of that stuff can be expected to be in there, which is why, again, it is overwhelming. But the dedication up front will pay off in the long run, in my opinion. So if you can confirm or deny.
Yeah, no, getting organized is so important. I've seen people with use makeup caboodles for their IVF meds, which I think is such a cute idea. But any way that you can just get everything together and put the refrigerated meds away and everything else in your box. And that way, when you start, I feel like you'll be so much less overwhelmed.
Yes, agreed.
So what are some of the common side effects for fertility medications? I know all of them are a little bit different.
So the most common side effects we see is you'll have patients complaining of nausea, diarrhea, upset stomach in general, bloating. You have mild to moderate pain, swelling or bruising at an injection site, which you had mentioned before, but nothing should seem severe without obviously immediately contacting someone. And the nature of that is it's similar to any other medication. There's side effects that are affiliated with something like a Benadryl or an over-the-counter. Even Advil has a list of potential side effects. Mm-hmm. So those are the most common ones we see. I think constipation after retrieval is one. So there's just different ones throughout the cycle that are common and expected.
And I think it's important to know, make sure you tell your provider about any allergies you have, because I actually know someone who had an allergic reaction to the progesterone in oil, I guess whatever oil it was, mixed with. And so then, she had more of a reaction at the injection site.
Well, it's good that was all that happened. I know we compound, I think, in 7 different oils for that specific reason. So the commercial, I think, is a sesame oil, but we have cottonseed, ethyl oleate is one of the most common ones that we use. But there's a whole slew of different oils that we can compound progesterone in, because we do see those allergies from time to time.
Interesting. Yeah, that's such an important thing that I hadn't even thought of again. I feel like sometimes you just take your doctor's word for it. You're like, oh, it'll be fine. And right. You don't really think of any of those repercussions.
Well, at Rosemont, we take down all of that information right away for patients, because they should always be asking any known allergies, anything like that. But again, when you're faced with all these different moving parts, it's easy to not really affiliate your random sesame allergy with your medications for getting.
Right, exactly.
So, I'm allergic to cucumbers, and I seem to overshare that with everyone. So
really, that's so funny. So how do patients typically learn to prepare and administer their meds?
So historically, I think it was very common for a physician's office to bring the patient in and do this full elaborate medication teaching. And I think especially since COVID, and even just with more modern technology and good resources, a lot of that has gone to more online content. So there's a lot of injection videos that are out there, and they can kind of walk you through step by step. Again, at Rosemont and with some of the other specialty pharmacies, one of our services is that, we do medication injection training. If you're a local patient, you can actually come in and we do it in a private room, or we do it via virtual or by phone if a patient is interested in that. But I think the online content has really come a long way and is sufficient for most patient needs. The the videos we link from our website are actually from Reunite, which is Organon's discount program who we work with. And the Rescripted videos are phenomenal. So I would also recommend them as well.
Yeah, for those of you who haven't sort of logged onto our platform, we have some medication management tools where you can get text message reminders when you're supposed to take your meds, and you can watch our med teach videos, and they'll be up on YouTube soon. We're working on it. I think that was about it. But so great to know that if patients have specific questions about their protocols, they can always talk to their pharmacy or call their nurse. Is there anything else that you think we left out?
Not that I can think of off the top of my head. I mean,
Someone actually asked, why are a lot of fertility meds used off label?
I'm not sure which meds we're talking about, and that's a difficult question to field. Which specific medications?
Okay. Oh, Lupron.
Lupron. I would have to look into that. I have not read the label recently, but there are, a handful of medications that are proven in different research studies that people are comfortable using, even if it's not the original intended use. I think HCG actually is like for weight loss, but it's obviously also has different implications. So I can look into
Oh, I see. So sometimes fertility meds are used for other reasons.
Yeah. Mm-hmm.
Got it. Is there another recommendation to alleviate the lumps from progesterone other than massaging?
Massaging is the main one that I've always heard of. I don't know if icing is appropriate or if it would help, but really just continuing to massage the area is the best recommendation that we've always had.
Yeah. Someone actually told me to do it right after you do the injection rather than like when the lump pops up. It's more like an immediate thing to just make sure the progesterone's going in. But I just learned that the other day because that was my own personal question too. Well, thank you so much, Christine. This was so helpful. And, our goal is to really make sure that people are not only, really just attesting to their protocols and not making like easily avoided errors by like not refrigerating their meds and just making sure that they're taking their meds on time. And we're thankful to have pharmacies like you on our side to help people with all of their medication questions. So I appreciate it.
Oh, great. Well, I'm so happy to help any additional questions that might come up. And again, when you are looking for a pharmacy, find one that isn't going to make you feel like you cannot reach out to them. We want to be there to provide the optimal support and really just to lessen all of the anxieties that might come along with any of these injections or questions that might come up.
Yep, you don't have to go through it alone.
Yes, you're here.
All right. Well, thank you again, and have a great rest of your day. We'll put up the recording in the community later today.
All right, awesome. Thank you so much for having me.
Of course. Bye.
Bye.